So what is schizophrenia?
Schizophrenia it is a very serious psychiatric illness. Psychiatric is the word for mental health disorder that a psychiatrist would diagnose. And basically, it's significant changes in thinking, feeling, and unusual or strange speech and behavior. And usually, all of those are encompassed. And the primary symptoms that are experienced in people with schizophrenia would be delusions. These are bizarre beliefs that are not true. Some of them, like they could be true scientifically. For example, someone's hearing me through the window or through the door. Technically, I guess that could happen, but if it's not really happening, they believe that. That's delusion. Sometimes it's very bizarre delusion. Somebody in Russia could hear me every time I get on the phone. That would be a very bizarre delusion. Hallucinations is another major category of symptoms in schizophrenia. That means being able to experience something that's not real. Therefore, auditory hallucinations means hearing, auditory. Visual hallucinations, seeing things that aren't really there. Tactile hallucinations, feeling. That means feeling something that's not really happening. Even olfactory, which is kind of rare, hallucinations, meaning smelling things that's not really there. So hallucinations is another common one. And confusion is very, very frequent. Confusing reality, things that are real and not. And another set of symptoms that are different from this set is feeling very withdrawn, isolative, not really wanting to be with people anymore, and it's not because of anxiety. And having no affect, meaning no facial expression, suddenly it's kind of looking flat, appearing as if they're not feeling anything. So that describes schizophrenia.
Isn't this just demon possession or demon oppression? What's the cause of it?
This is a very common question, and I'll be happy to answer that. The illness of schizophrenia, the psychiatric illness of it, is a combination of brain changes, biochemical causes or imbalance, genetic factors, and the key neurotransmitter, meaning chemical in the brain, is dopamine when that is not acting right. Now, there's also a biological trigger that can cause schizophrenia-like symptoms, which would be constant drug abuse or usage. There is research already about how marijuana can do that. And so many others, for example, amphetamine, the street nickname is speed, crack, cocaine, those kind of street drugs can definitely mimic schizophrenia-like symptoms. So the question about demon possession though, right? I can understand why it's confused because schizophrenia patients who have hallucinations, who have bizarre delusions, especially bizarre religious, hyper-religious delusions, they can really look like a demon is affecting them, right? But I would say demon possession or oppression is when someone's body and mind is completely or is controlled by an evil spirit. Whereas somebody with schizophrenia can look like that, but it is caused by their dopamine imbalance. Now, there could be a few cases where it's happening at the same time, right? Just demon possession, there's a good example in the Bible when, and forgive me, I forgot exactly where it is in the Bible, but the demon-possessed man could not live with anyone, and then he was isolated in a cave, I believe, and sometimes they had to try to chain him up, otherwise he was going to become so violent. he slashed himself and hurt himself. And when Jesus came to that town, he casted out the demons, right? And then went to, oh, I remember now, Mark chapter 5. Well, you can read about that. And Jesus casted out the, not just one, but a legion, meaning many, many, many. And then they were thrown into the pigs, right? And then he became completely sane, completely normal. And that was a miracle done by Jesus. That was a completely 100% demon possession and not schizophrenia. So I have another example on the flip side. It was definitely schizophrenia, but not demon possession or oppression. Now, let me just side note. Anybody with mental illness or struggles with their thinking, Satan can use that as a tool to influence that person even more negatively and cause their quality of life to be more terrible, to cause more disbelief, to cause them to seek after anything else for help except God. Right? That kind of influence is there always with any disease or disorder. But I did know a Christian, as a matter of fact, he was a pastor with a true diagnosis of schizophrenia. When he took the medications to help with the dopamine function, much better. So well that the clinic that was helping him discharged him, but said, keep taking your medications and go to a private doctor. Then I met him. But by the time I met him, he wasn't doing so hot because he stopped the medication. So that one was a true case of just schizophrenia and not demon possession. Good news about this person, after many years of finally staying compliant, taking his treatment, not guessing when it's time for God to heal him, he did experience a miracle. Now, I don't know if he's still on medications or not, but he is very well functioning and he is doing ministry and helping many others with the same condition and to help them as well. So I hope those two examples can help describe this answer of how to tell the difference.
Is there a cure for this illness?
For the medical illness of schizophrenia, it is said that there's no cure if you're defining cure as having no more symptoms and you don't need medications anymore. Where you did suffer from a true schizophrenia illness and then suddenly you don't need the medications anymore. But it is very, very treatable. If it's pure schizophrenia, the biochemical brain disorder, it is effectively treated, especially because medical technology has advanced. Many more medications, and they're checking it for safety for children as well. And so if it is a demon oppression moment or a demon possession moment, that will definitely be up to the Spirit of God to cure that or remove that or resolve that. And it's not easy to know, is it this or is it that? So that's why we can't just easily label that's demon possession or that's just schizophrenia. It could even be both, or you could go back and forth. So we do have to be aware of when we need medical professional assistance for that diagnosis and when to pray, which I would say you have to pray either way, both ways. Because if someone is going through any medical, physical, or psychiatric issues, the devil can utilize that to make that person's life more miserable, to make them not enjoy God's promises, to make them forget how much Jesus loves them, to make them forget their identity and forget their purpose in life, whether it be a depression, anxiety, or medical problems like diabetes or a serious psychiatric problem like the one we're talking about, schizophrenia.
How common is it for children to suffer from this?
Well, thankfully for children, it's not common in very young children. And the average age of onset, which means the age where we usually start to wonder and diagnose schizophrenia, is late teens, such as 17, 18, 19, but most of them are early 20s. So those who are about to go to college or started college, that's kind of when we really want to wonder if someone is exhibiting or displaying the symptoms that we talked about earlier.
It is very uncommon in children, but how can we recognize it in children?
Yes, during the early phases, we call that prodromal phase. It's very difficult to recognize, actually. But I'm going to tell you a list of symptoms that if you start to see this in combination with all of these symptoms, and it starts to get worse or persistent, then generally you have to think about, what is this? Not that what I'm about to tell you is directly equal to schizophrenia. So it's a reverse way of me telling you what to look out for general psychiatric problems. For example, feeling or looking confused, new academic or new behavioral problems, like suddenly they're having this new problem that they're showing, mood changes, a lot of depression or a lot of elevated moods for no reason, thoughts that seem strange. Right? This is going to be very obvious, like paranoia, someone's out to get me, or someone's talking about me. That's paranoia examples. Especially this one, confusing TV and dreams with reality. Like they really think those things are real. And hearing and seeing things that really aren't there. And that one, most people don't make that up, but it's age dependent too. Developmentally, someone could have imaginary friends. But even then, the child, if you ask the child, is it your imaginary friend or do you really see that person like the way you see me? They could tell you the difference.
What can teachers and parents do when we feel a child may suffer from this illness?
First, I want to say, of course, everyone's going to pray, right? But not that I'm minimizing, please don't misunderstand me. Don't only just pray. I feel that somebody should evaluate, the child, and usually it's should be a skilled or experienced clinician. And in America, we will say child psychiatrist or a psychologist, a skilled pediatrician, and not just guess on your own what it is. And we would need to monitor. For example, earlier I talked about imaginary friends. So we should know developmentally what we expect for that child at their age and kind of checking with them. Do you believe that? But without this, do you really believe that? Not that kind of tone, but a pure question of curiosity. Is that real or kind of your imagination? And then monitoring what kind of delusion it could be, for example. And also, what teachers and parents can do is continue to receive training, right? How to support the development of that child academically, socially, spiritually, while they're going through this. Because it's possible that it is a brief phase. But if it is ongoing, lasting 6 months straight, and now it's a year, and their behaviors are becoming more difficult to control, this cannot be ignored.